my questions are, should every patient with FH have LPA measured, even though we can't really do anything about it right now, maybe sometime? And how does it actually impact on your clinical management of a patient with FH when you know that they have a high LPA, for example?
Right. Well, like our guidelines in Canada, they're certainly being revised. We're now recommending that everyone, you know, FH or not, have LPA measured once in their life, usually, you know, the first adult lipid screening, because it does add to risk predictability irrespective of other risk factors. Certainly for patients with familial hypercholesterolemia, very important. We have that much older work from the 1980s showing that patients who have a high LPA and FH develop coronary disease 1 decade earlier. So yes, I think it is important. It's one of the easily measured genetically determined markers that really is protective. You agree, Rob?
Oh yeah, totally. I think LPA. And so then, you know, how do we use it? So if I, you know, so for certain everybody with FH or everybody who comes to lipid clinic should get an Lp(a) determination. And so, yeah, so then that's the patient that should be, you know, their risk is amplified. So, sometimes, I mean, sometimes they're, it's a minority, but sometimes their FH is actually due to the fact that their the cholesterol in the Lp(a) fraction is so off the scale that it's actually kind of an artifact almost. But yeah. But then the other thing, of course, is we have there are new biologics coming down the pipeline, and we would be able to test the hypothesis directly. But,
yeah, exactly.